Starting with the general survey, I'm just going to look at the overall status of the patient. Can you tell me your name?
Dominic Gearing.
And where are you?
Home.
What is the month and year?
April 2020.
Thank you. I'm also going to look at the posture, position, and look for any distress of the patient. He seems to be sitting up straight as usual. His position seems comfortable. And there seems to be no signs of acute distress. I'm also going to look at his dress, how he's groomed, listen to his speech, and have you had any, do you feel any pain right now?
No.
I'm also going to look for any signs of obvious deformities. So, and then when I do the Glasgow Coma scale, it would be a 15 out of 15. So the patient is a well-groomed, well-appearing adult male who's alert and oriented ×3, no acute distress, reports no reports of pain, who has a Glasgow Coma scale of 15 and is sitting comfortably. Onto the skin. Do you have any moles or lesions you're concerned about?
No.
I'm also going to look at the color and pigmentation of the skin, making sure it's normal. I'm also going to touch the skin if that's okay. Testing temperature, moisture, and texture. The skin is pink, warm, dry, and intact, and there are no clear moles or lesions that I'm able to see. Onto the head. Do you have any headaches or anything?
No. I'm
just going to palpate and inspect the head, looking for any bumps or tenderness. Do you feel any tenderness on the head?
No.
Okay. And then I'll have you raise your eyebrows and puff your cheeks. Okay? There's no tenderness to palpation. The head is normal cephalic and atraumatic. And facial movements are symmetrical bilaterally. Onto the eyes. Have you had any blurriness of vision?
No.
Okay, I'm going to do the equal ocular movements. Just follow my finger. Okay, looks normal. Then Perla will be assessing the pupils, making sure they're equal, which they are, round, which they are. Reactive to light, I would use a pen light and just go across the eyes, making sure that they both constrict. And then accommodation, I would just put my hand in between the two eyes so they're separated and put light in one of them and make sure that the opposite eye is also constricting. Onto the ears, have you had any trouble hearing?
No.
Then I'll just palpate the outer part of the ear, the auricle and the tragus, to make sure there's no tenderness. Is there any tenderness?
No.
Okay, no tenderness to palpation of the auricle or the tragus. Onto the nose. Have you had any trouble smelling through your nose?
No.
Okay. I'll have you plug one of your nostrils, breathe in and out, and then same with the other, in and out. And the nares are patent bilaterally. Onto the neck. Have you had any stiffness on your neck?
No.
Okay, I'm going to first assess the cervical lymph nodes, the anterior and the posterior. They're going to be on the anterior and posterior triangles, respectively, of the neck. And I'll just do so by palpating, making sure there's no lymphadenopathy. Sorry if I'm not saying that right. And there doesn't seem to be. And then I'll also do the carotid pulse. First, by palpating it, it'll be in between the sternocleidomastoid and the trachea. Okay, it's +2 out of 4. And I would also use my stethoscope to auscultate the carotid. And there are no bruits to auscultation of the neck. Lastly, I'll make sure that the trachea is midline, and it is. Onto the upper extremities, have you had any trouble moving your arms?
No.
Okay, I'll just have you stand up and you'll do what I do. I'll have you flex, extend, pronate, and supinate. Then we'll go back down here. We'll abduct and adduct, externally rotate and internally rotate. Then we're going to go to the wrists. We'll flex, extend, hyperextend onto the, and we'll bend laterally. The fingers, we're going to abduct, adduct, flex, extend, hyperextend, just bend them backwards. Did I do abduction? We'll abduct and adduct, and then we'll palmar adduction just with the thumb and the forefinger. Okay? And then, I'll have you push against me. We'll go up and we'll go down. Thank you. You can sit down. Then I'll note the pulses. First, the brachial pulse will be on the medial side of the inner elbow, and the radial pulse will be on the lateral side of the inner wrist. Both are +2 out of 4 or normal. Lastly, I'll just check the capillary refill of the fingers to make sure that it's within 3 seconds, and it is. So there's full range of motion. Muscle strength is 5 out of 5. The pulses are both +2 out of 4, and capillary refill is within 3 seconds. Onto the heart. Have you felt any flutters or anything abnormal?
No.
Okay. First, all I'm going to do is just listen to 5 places of the heart. Doing so, I'll listen to S1 and S2, or the cardiac cycle for each. S1 will be systole, and S2 will be diastole, making sure that the heart rate and rhythm are normal. So I'll turn towards the camera. Starting with the aortic area, the second intercostal space on the right, I'll listen for a whole lub-dub. Go across the pulmonic, which will be the second intercostal space on the left. Going down from there, the third intercostal space on the left will be Erb's point. Fourth intercostal space will be the tricuspid area. And then the fifth will be the mitral. And again, I'll just make sure that to listen to the heart rate and rhythm are normal. Onto the lungs. Have you had any trouble breathing?
No.
Okay. I'll go to the second intercostal space again and listen to both. Listen for, with my stethoscope, to listen for a full breath in and a breath out on each lung to assess the upper lobes. And then I'll have you turn around and bend your neck down. And then I'll find C7, which is the cervical prominence, and I'll count my way down to T3. I'll listen on either side above and below to assess the upper and lower, and then down by T11, I'll assess on either side to assess the lower lobes. You can sit down. And if normal, all lung fields should be clear to auscultation. Onto the abdomen. Have you had any trouble digesting any sorts of foods?
No.
I'll first start just by light palpation to assess for any tenderness or swelling abnormal. Is there any tenderness?
No.
And then deep palpation will be just to assess specific organs. Then I would listen with my stethoscope in all 4 fields, or all 4 quadrants, making sure to listen to each for 30 seconds. Whatever number I get from that 30 seconds for one specific quadrant, I would multiply by 2 to get a full minute. And it should be in between 5 to 20 to be normal. So there's no palpation, no tenderness to palpation, and there's bowel sounds present in all 4 quadrants. Lastly, onto the legs. Have you had any trouble flexing or anything with your legs?
No.
Okay. The 3 main pulses of the legs are going to be the popliteal, which will be behind the knee. The the posterior tibial will be behind the ankle on the lateral side of the leg, and then the dorsalis pedis is going to be on the dorsal side of the foot laterally. Then lastly, I would just check for any pitting of the leg, which would be a sign of edema. Also palpate for any tenderness. Is there any tenderness?
No.
And also look for any color changes, which would be abnormal. Thank you.